COVID-19 has pushed the Canadian health system beyond its limits after struggling to manage hallway medicine for over a decade. A Canadian startup is working with University Health Network to change this by building mobile medical units from converted shipping containers in Hamilton. To tell us more is Sabrina Fiorellino, founder and CEO of Fero International. Good morning. Thanks for joining us via Skype.
Good morning, Bob. Nice to see you this morning.
So where and when did this idea come up? It was personal for you, wasn't it?
Yeah. So my mom is a double lung transplant recipient, and my brother and sister-in-law are both Healthline workers. And unfortunately, my grandfather passed during the first wave of COVID, not from COVID, but it was the first hospital admission. I couldn't stay with him in hospital. So because of all of these things combined, I decided with a number of partners to create medical mobile infrastructure to help solve these issues. One, to make sure the hospital can stay open during regular function. Two, to keep frontline workers and patients safe. And three, to make sure that people could visit their loved ones even during times of COVID.
So these units, and we'll show some video here, how quickly did the prototypes come together, and where are we at now as far as production? And what's the consultation process like to create these shipping containers into an actual hospital room, be it an operating suite or an ICU?
So we built the prototype in less than 3 months. We went through a week-long consultation with UHN that did simulations on both the operating room and the ICU room. They tested different scenarios where patients were stable to patients who coded, and now we're ready for production. We're soon to be deploying our first prototype to Toronto General Hospital, and we're very excited about it.
And so what the air environment, there must be some pretty sophisticated filtration technology in these things.
Yeah, so each individual patient room has its own HVAC unit. So there's no cross-contamination of air between rooms. And we can exchange up to 30 air exchanges an hour, which exceeds CDC requirements. And all rooms can switch from negative to positive to neutral pressure with the flick of a switch while maintaining temperature control and filtration.
What kind of regulatory hoops have you had to go through here to get them approved?
So because we're building infrastructure and not a medical device, we've just complied with all of the building codes, ESA, CSA, TSSA, and as many other building codes that we could find, although there's not too much for mobile medical infrastructure. But we've tried to comply with the regular code in order to ensure our rooms were safe.
Okay, I noticed in some of these pictures, so these modular units can attach as well. You essentially created a hospital in itself.
Yeah, we can attach as many or as few units as necessary. We can create pharmacies or laboratories. We can increase capacity on a bed-by-bed basis. So if we had a call from government or from a long-term care home or from a hospital and they said we need capacity of 5 ICU beds, we could deliver that. And then, a week later, they asked us for some operating rooms, we could deliver that and attach them all together through our proprietary technology.
Okay, obviously Canada first, but are you eyeing any export potential here? Is that possible?
We're looking into the US, South America, and the Asia Pacific region. We've had interest in all of those regions, so we're working closely with governments and stakeholders across the globe.
What's the capacity in Hamilton? How many and how quickly can you make them?
So after a ramp-up period, we can build about 30 units a month, which is 60 rooms. And then we've created a network of other Ontario manufacturers to help with surge manufacturing when required.
Okay, so again, you mentioned you're ready for your first deployment?
Yep, we're going to deploy our units to Toronto General Hospital in the coming weeks to prove that we can deliver within 24 to 48 hours of receiving a phone call to deploy.
Wow, an amazing innovation in these incredible times and a great solution for the pandemic and the great pressures put on hospitals. So thank you for coming up with this and making it happen so fast. Sabrina Fiorellino from Fero International, thanks for joining us.
Thank you, Bob. Thanks for having me.